Hi, everyone. This is Tori Vandelin with Prevent Connect. This podcast is part 2 of our podcast revisiting the conversations that we've had with folks around preventing sexual and intimate partner violence during the COVID-19 pandemic. So we've done several web conferences and a couple of podcasts with folks talking about how they've been able to adapt, shift, and change their sexual and intimate partner violence prevention efforts since March 2020. And we know that many of these efforts will be long going too. You know, when the stay-at-home orders first started, something that I was thinking about a lot in relation to sexual and intimate partner violence prevention is that so much of our prevention activities were in person, you know, whether it's at community centers or in campus settings or in schools. You know, it's a lot of that person-to-person interaction and discussion and connection that facilitates these prevention breakthroughs for folks, or that really builds a community of care. So, you know, in addition to the added stress that folks are experiencing that puts them at risk for perpetrating sexual or intimate partner violence, the economic insecurities, you know, the fear, the loss, the grief, all of that, there's also felt like this element of like, well, what do we do now? What can we do now? And there are so many people in the field of sexual and intimate partner violence and in other fields that really embraced this change and this opportunity to be creative and to center their prevention or recenter their prevention on connection to community, bringing humanity back into prevention, really focusing on this kind of shared or linked fate that that folks may have, and having such a clear focus on, you know, we all feel a little disconnected during this pandemic. So how can we increase that connection and also prevent sexual and intimate partner violence? So on our last podcast, we revisited some folks. We revisited some quotes from folks about how our context has shifted since the start of the COVID-19 pandemic. And on this one, we're going to talk a little bit more and explore some more examples of folks of tangibly, you know, what are they doing to prevent violence? What have they done in the last 6 months? What are their plans for the future, knowing that our context is totally different now? So I want to start off with what Alicia shared during our web conference, Preventing Violence in Our Homes, Meeting This Moment with Connection, Care, and Justice. And here Alicia talks about what she's heard from folks in the ways in which they're preventing multiple forms of violence.
So in our web conference title, we include the words connection, care, and justice, which we believe are critical to preventing many forms of violence, many forms of violence in the home, whether it's child abuse, intimate partner violence, suicide, gun violence, a lot of the things that we've been hearing about in the news and experiencing in our communities. And so these words are really intentional in the web conference title, and so just wanted to share a little bit about them. So connection really has to do, you know, I mentioned social isolation before with the pandemic. And so we really see cohesion and connectedness as a protective factor against violence and to support safety. And I know connection needs to look a little bit differently right now. So we wanted to highlight that. And I saw in the text chat, someone had written about how do we engage with people who don't have access to the web. So hopefully that's a thread we can continue to discuss. Care really has to do with meeting immediate needs and how by doing so, we can really decrease family stressors and support safety at home. And justice relates to advocacy, policy, and systems change, really thinking about it for health equity and racial justice. both right now in the immediate moment and also long term. And with those three themes, we have some emerging actions that we've started to hear about from communities that we're partnering with. So things like groups starting to identify and advocate for the emerging needs that are happening. And some of our guests are going to talk about this today. We've been hearing about communities trying to support healthy relationships and redefining what healthy relationships might look like during stay-at-home orders. People are also getting creative about what these social connections can look like, as I mentioned. We've seen a lot of people in the field sharing messages of hope, resilience, and self-care, whether it's through group chats or social media or putting things up in apartment complexes. Another action that we've been seeing is around confronting racism and xenophobia as public health issues. Just this week, or starting last week, some of the news reports started to finally apply more of an equity lens and thinking about who's most affected. And there was a lot on African American and Latino populations. We also know that Asian Americans have been experiencing quite a lot of discrimination with this virus. So there's actions to take in that realm as well. And then the last one is around making the case for gun safety. Also been hearing a lot about increases in gun purchases and some dealerships being able to remain as essential. So thinking about what does safe storage look like? How can we really make the case for gun safety as well?
So just before we had that web conference that Alicia facilitated, we hosted a web conference with our local colleagues, Alejandra Aguilar and Sarah Orton. Alejandra and Sarah had a conversation about what does it mean to be a preventionist right now? And what I really appreciate about what Sarah and Alejandra said, and we'll listen to it in a second, is they really built off of the skills that preventionists already have. And I hope you all enjoy the animal analogy or reptile analogy, animal, reptile, who knows. Alejandra has a really great analogy in her quote. So we will listen to what Sarah and Alejandra said during our web conference, Let's Connect, Sexual and Intimate Partner Violence Prevention During a Pandemic.
I think as new social norms emerge, it's really essential to leverage a critical eye towards preventing violence, especially. We know that public health models that discuss creating protective environments and eliminating risk factors is a really important area, and especially as those things really intersect with the root causes of violence, such as oppression and inequity. Also, social and structural inequalities are being highlighted now more than ever as new trends and things start to emerge. And I also want to say that there's really an opportunity in addressing these as they're kind of glaring right in front of us at this moment. So I think one thing is that it's important to start asking ourselves, especially hard questions about accessibility, as these dichotomies start to become more apparent. So, for example, how do we make interacting online normal and accessible for those, particularly those who are marginalized? What norms do we perpetuate that center white idealized concepts of professionalism? What aid are we providing to the community in return for them showing up to our cause, right? We know that we still have participation in our prevention groups, that we still have clients needing our services. And if those folks weren't showing up for us, that would be, that would be a detriment to our livelihood. So, starting to really think through, is there showing up for us in those ways? What ways do we have at our disposal to show up for them? Also bringing us back to grassroots organizing and how our movement started in the early 70s, even before government funders and Zoom meetings and school-based programming. Our field was built on grassroots feminist organizing organizing. And, while public health, which we'll be talking about as well on this web conference, certainly offered assets and some really helpful framing tools, it's ultimately not what shaped the social justice aspects of our movement. And I saw some of this come up in the text chat. I've heard this come up in our California RPE groups. It may feel that right now our prevention work is less essential as focus shifts to crisis response and direct service needs. But our role as preventionists, in the long run, or in the scheme of things, is really to help people make those connections and to see the bigger picture. So now more than ever, it's really time, I think, to shift our focus away from, obsessively trying to meet grant deliverables and center ourselves in the heart of what this work is really about.
I think for me, the key role of the preventionist is there's a colleague of mine, Miranda at the partnership, and we joke about being chameleons. How many of us as preventionists have showed up into spaces where we're told that we're going to have a classroom full of, 30 youth, and guess what? There's been a challenge and you have 5, and you had these activities planned that you were going to develop, and now you're not going to be able to carry them out because you only have 5 folks in there. Or you were supposed to have a room full of parents and only 2 showed up. As preventionists, we adapt to challenges. We thrive when things are not the way we're supposed to respond. So for me, this is a time to remind ourselves about these skills that we have, about these strengths as prevention chameleons, and to be tolerant of ambiguity. There is so much ambiguity all around us right now, and it's important for us to show up in this way. Right. Prevention unicorns. We're the only ones that do what we do in the agencies. Absolutely. So let's remind ourselves of this and let's lean into those strengths. Prevention started, as Sarah is mentioning, from feminist organizing in response to crises, in response to problems that were showing up in the community. And they didn't show up with solutions. They leaned into the community to find solutions that would be responsive of those needs the community was facing.
So I really like what Alejandra said about preventionists being chameleons and being really used to and uniquely skilled to handling any challenges that are thrown at them in creative ways that bring prevention back to the center. And I think one of the most creative ways that I had heard and that I really appreciated hearing more from was from Janae Sargent, Yuvia Cervantes, and Morgan Martinez on our 2-part podcast that we released in a previous month on violence prevention and mask making. And it was so great to have a conversation with them and feel their light and their hope and their creativity come through even just a Zoom call recording when we did the podcast. So one of the main takeaways from this podcast was, communities have a lot of needs right now, and preventionists and folks working in sexual and intimate partner violence prevention are in a really unique position to meet those needs. So Janae, Yuvia, and Morgan talked so much about how does mask making or distributing masks to communities, facial masks that prevent against the spread of coronavirus, how does that relate to sexual and intimate partner violence prevention? And that podcast really ties up the theme of when we're talking about prevention, we're talking about connection, care, and social cohesion. We're talking about community building. So I super recommend that folks check out both parts of that podcast. They are linked in the podcast page on our website. And in our web conference, Preventing Violence in Our Homes, Meeting This Moment with Connection, Care, and Justice, we had 6 groups of presenters over 2 different web conferences come to Prevent Connect and just talk about what they're doing, how they're adapting, how they're changing. We heard from folks from Ujima Inc. talk about, when the coronavirus aid packages, the CARES Act first came out, there was some policy language that wouldn't have met the needs of everyone who needed the stimulus money. So they used their legislative advocacy to make sure that the policies were changed a little bit so that there were also physical checks for folks too. So our friends at Prevention Institute listened back to all of those stories from those 2 web conferences on preventing violence in our homes and created 3 wonderful blogs that pull out these highlights from it. So those are also linked on this podcast page. So these episodes are coming to you all late September, early October 2020. What we know is that our context continues to change, but what we also know is that folks who are working in or interested in the prevention of sexual and intimate partner violence are agents of change who embrace change and are creative in their solutions. So we hope that listening back to some of these highlights of the last 6 months and these conversations that we've had are able to inspire you and motivate you and give you hope that, while we're still in uniquely stressful times, we're also uniquely positioned to create the change that we want to see in our world. So again, thank you for joining. Thank you for listening. We will have all materials that we referenced in this podcast available on the podcast page on our website. Take care.